Hello guys, welcome to my YouTube channel Stepwise Lapro OBGY. Today I came with very interesting case with a chronic ectopic pregnancy with hemoperitoneum, rising beta hCG levels even with medical management with methotrexate and leucovorin injection. You can see the hemoperitoneum is present around roughly 50 to 100 ml. It was a chronic ectopic pregnancy. So we planned laparoscopic salpingostomy to open the fallopian tube, remove the ectopic pregnancy, and save the tubal portion as much as we can. So you can see this is a hemoperitoneum. Uterus is mildly bulky. Left side there is normal fallopian tube. You can see this is left side fallopian tube and ovary. There is no ectopic pregnancy in this side. Now we will go on to the another side. We'll look for tubal ectopic pregnancy. Here it is. On to the ampullary region, you can find a chronic ectopic pregnancy which have bleeding from the fimbrial end. You can say a tubal abortion in this case also. So what we are planning for this patient is, as there is no active bleeding, we are plan to save the tube as much as we can. We will give saline wash to clear the picture, and if there is any bleeding, so we can get to know that this is a new bleeding, so we can plan accordingly. So we will suction it out all the old bleeding which were accumulated in the pouch of Douglas and clear. As we have planned to save the fallopian tube on the right side, we will hold the fallopian tube in such a manner in a longitudinal axis that we can give incision over the most prominent part and remove the ectopic material. So I am holding with a grasping forceps and planning to give incision over the fallopian tube. The ectopic pregnancy is bulging as we are holding the ectopic pregnancy in such a manner, so we can give incision type onto the ampullary region. I will fix with one hand and with bipolar shearer with minimal current we will try to open the fallopian tube. So we have successfully opened the lumen, and I have negotiated one arm of shearer into the fallopian tube, and you can see the ectopic pregnancy itself pop out from the lumen, and the whole pregnancy we have removed from the fallopian tube. As this is a chronic ectopic pregnancy, so it's look like this. The whole embryo has been removed successfully. Now we will look for the lumen patency also, and is there any active bleeding or not. We will give saline wash and try not to coagulate, so we will save the fallopian tube for the future pregnancy. So there is a minor bleeding, so we'll coagulate little bit over there, carefully not to injure the lumen. Yes. Now there is no active bleeding. So, what another thing we should do in such cases, like there is ectopic pregnancy, so there is a decidual reaction or decidual collection into the fallopian tube. So we need to clear it out also. Likewise, we do in DNE, we are clearing out decidual reaction or scraping of endometrium to remove the decidual reaction. So we'll do that into the fallopian tube via pushing a betadine from the uterus. Also, we will check the lumen patency onto the ectopic side also. So we are moving forward for the tubal patency test and looking for the lumen. As you can see, there is no active bleeding from the fallopian tube. So we will save the fallopian tube on the ectopic side. We will suction it out all the fluid slowly and look for any bleeding. We will remove the ectopic pregnancy for the biopsy. As I said, we will do tubal patency test and clear the fallopian tube's decidual reaction or decidual collection material onto the same side. So we are negotiating from the uterine end and pushing the betadine. You can see the gush of flow coming from the fallopian tube, and we'll look for it if there is a material coming from that ectopic site. And you can see the portion of the salpingostomy part, there is some clot coming out from the tubal lumen. We will remove it out. There is no active bleeding as we have seen before also, because it was not bleeding at all before pushing the betadine dye from the uterine end. So we will give a saline wash and we will suction it out and slowly remove the residual material from the fallopian tube onto the ectopic side. You can see there is a clot like structure. We will slowly remove it out from the fallopian tube. and we'll give suction once again and clear it out. As we are planning to save the fallopian tube and future pregnancy outcome, we are not damaging the fallopian tube on the same side. You can see there is no active bleeding and we have saved the fallopian tube. Thank you for watching whole video.